Unit 6 Virus. Viruses are too small to be seen by the naked eyes. They can't multiply on their own, so they have to invade a living cell to reproduce. Once a virus enters the host cell, it takes control of the cell and forces it to make more viruses. Viruses consist of genetic materials surrounded by a protective coat of protein, so they are more difficult to kill than bacteria. If you have a minor illness caused by a virus, the best thing to do is to just let it run its course. Antibiotics do not kill viruses, and the use of them just leads to antibiotic resistance. However, vaccines can help prevent many viral infections. A vaccine typically contains an agent that, that resembles a disease-causing microorganism. It stimulated the body's immune system. The immune system recognizes the agent as foreign, destroys it, and remembers it. The result is that the body is prepared when the same invader attacks again. Influenza, commonly referred to as a flu, is an infectious disease caused by viruses. It affects mainly the nose, throat, bronchi, and occasionally lungs. The symptoms are chills, fever, sore throat, muscle pains, head aches, coughing, fatigue, and general discomfort. The flu is often confused with the common cold, but flu symptoms are usually more severe. Typically, influenza is transmitted through the air by coughs or sneezes, as the virus can be inactivated by soap. Frequent hand washing reduces the risk of infection. All symptoms usually disappear within a week or two. However, it is important to treat the flu seriously because it can lead to pneumonia and other life-threatening complications, particularly in the very young, the elderly, and those with long-term health problems. Rabies is a virus that is usually transmitted by a bite from the wild infected animal. The rabies virus infects the central nervous system, ultimately causing disease in the brain and death. After a bite, the virus spreads into surrounding muscles, then travels up to the brain by following the nerves. Post-exposure prophylaxis should be administered before the onset of severe symptoms. The average incubation period in humans is 30 to 60 days, but it may range from less than 10 days to several years. The early symptoms are flu-like. As the infection progresses, patients may develop slight or partial paralysis, anxiety, insomnia, agitation, abnormal behavior. paranoia, hallucinations, etc. In the later stages, patients cannot speak or swallow. This can result in hydrophobia, fear of water. This almost invariably results 2 to 10 days after first symptoms. The computer networks of the company have been infected with software viruses, which transmitted its clients' data overseas. At least 5 viruses were detected to be activated each day at 9 p.m. The company administrators determined the problem was widespread and that the viruses had been lurking in its computers for more than a month. They have not yet ascertained exactly what information have been stolen, although it is suspected that personal information and financial data on credit cards have been transmitted. The security breach could affect more than 8,000 clients. The company officials said that they have shut down the company's computer system to prevent further spread of the viruses and had notified the victim of the virus infestation.